Welcome to Muscat Endoscopy Academy. In this video, we are demonstrating how to mount the 7-shooter on a gastroscope and thereafter how to re-intubate the patient and apply the bands that are on the banding device in order to either stop an ongoing bleeding from varices or to treat primary varices or also for secondary prophylaxis. Now, it's important from a nursing point of view to understand what it is we are looking at. So this is the 7-shooter that we took out of the box after taking the scope out of the patient. And you can see that it has the blue ribbons, as well as then the one before the last one is white, and then there's a blue one, which means that you have 5, and then you have the 6th, which is your next to last one, and then you have the last blue one. And the idea here is to try not to fire the last band unless you absolutely have to, and that is specifically to use it as an emergency banding device in case one of your bands may not succeed or they pop out of place and cause issues. Now, how do you go about doing this? So we have the catheter that we should insert through the working channel of the scope. As we are inserting it, we are going all the way in, wait until it comes out from the other end of the screen. Endoscopic banding devices, they come from different manufacturers nowadays, but the concept has continuously been pretty much the same. And then we attach the wheel handle around the scope, and we would like to have the wheel on the same side as the wheels of the scope itself. That's from an ergonomic point of view becomes easier. And then we just fasten it around. And now there are two ways of going about this: either twisting in order to bring that wire into the scope, or by just tugging at it. Firstly, what we do here with this 7-shooter, for example, we have to mount the shooter itself and then put it in, and then we check what it's looking like on the screen. And what we're trying to aim for is somewhere between 5 and 10 o'clock position, which may give you a very good capturing of the bleeding vessel in order to stop it. So as we can see in this particular example, after mounting the band ligation device on the scope, we go in and we try to start always as distal as possible to the varices themselves. And the idea here is basically to decompress the varices distally, which sometimes might cause them to deflate slightly proximally. We try to aim for about 6 EBLs per session, but sometimes when we have a severe bleeding, we can do even more. And this is just to reduce the risk of adenophagia, dysphagia, and even the risk for ulceration post-banding. So as you see in this case, we are pretty much happy with the result that we're getting. You see the bands sitting in place. One very important aspect of this whole thing is that for an endoscopist, when we actually go and grab one of these vessels, it's very important that we do not let go. So it's very important for the endoscopists to take their time in selecting the correct area and keep your finger on the suction while working your way right and left with your left hand, and sometimes with a little bit of work to work with the small wheels to bring the base of the varix inside the cap. It can be slightly dangerous to suction the varix in too much and then dropping it, because that may cause a varix to start bleeding. And in the same time, it's also important to not to try to damage the bands that have already been placed. So not to try and bypass them, but rather to take grab another varix that is on the opposite side and not too close to the initial one, but not too far away either. And simultaneously, if you get too much bubbling happening, you should have a syringe with simethicone ready to wash the area so that to make sure that you do not have too many bubbles building up, water jet as well. So you see here now as we're going proximally and these varices are deflating, it's becoming slightly more difficult to actually get a full readout sign. That is sometimes one of the good things that we can see here. This is a case of a patient that had end-stage liver disease, and he has had some severe bleeding right until his point of presentation, and was both from esophageal varices as well as from gastric fundus varices. So here we actually used two sets of bands. We used a total of 10 of them, which is why here, like, we even used even the last band that was left in this group of bands that we had on our device. The result was satisfactory. The patient did not bleed after that, and this is the way we should usually aim to do this kind of procedure. Thank you very much for paying attention.